Dr. Gary Smith, who's president of the Child Injury Prevention Alliance, and also the founder and director of the Center for Injury, Research, and Policy of the Research Institute of Nationwide Children's Hospital. Dr. Smith has been an active researcher in the area of injury prevention for more than 25 years. Dr. Gary Smith has conducted 2 studies within the U.S. and 2 studies outside the U.S. related to fireworks injuries. He probably has conducted even more than that, actually. He is recognized as a national and international expert on this topic. Please welcome Dr. Smith, who will share his knowledge with us on this significant cause of injury among children. Dr. Smith.
Good afternoon, everyone. Thank you, Sherry, for that nice introduction. So, in addition to the titles that you gave me, one of the things that I do and have done for now, close to 3 decades, is I'm a pediatric emergency medicine physician. So I've worked in many large pediatric trauma centers, including the one here, actually ran the emergency department here at Nationwide Children's Hospital in Columbus for 8 years. But I've treated children who have suffered major trauma in various parts of the country, including children that have suffered injuries from fireworks. And I also have been involved in the topic with the American Academy of Pediatrics. I was the lead author of their policy statement on firework-related injuries to children, and I was also the Academy's representative with the National Fire Protection Association when we established the Coalition Against Consumer Fireworks a number of years ago, which now includes more than 20 national organizations in the area of medicine, public health, and fire. And as Sherry mentioned, I've also done a number of research studies looking at injuries primarily to children due to consumer fireworks. So as someone that has spent a fair amount of time thinking about this topic and involved in the research, I think one of the most important take-home messages I can give you, and that is that simply, there is no safe way to use backyard fireworks. Every legally available type of consumer firework has been associated with serious injury or death. In 2006, we published a national study, and this was a study with more than 85,000 children who were treated in emergency departments across the country over a 14-year period. And they were treated for firework-related injuries. One of the most important findings of the study was that about 1/4 of these children were bystanders. They weren't even handling the firework. They were simply there as spectators and were injured. And what was also important was that they were disproportionately represented among the 1/3 of that group that required hospital admission, which really clearly indicates the severity of their injury. This tells us simply that being near someone using fireworks places a child at serious risk of injury, and that it also dispels the myth that it's safe for a child to watch as their parent handles the firework. Now, these findings agree with the study that we published previously in 1996. These were injuries, firework-related injuries to 300 children treated in a large children's hospital in Kansas City over a 17-year period. And the injuries in this study were quite serious. 11% required admission to the hospital. 1 patient died. 5% went to the operating room. And 10% had permanent long-term effects from their injuries, including 2% with vision loss. In this study, the injured child was a bystander in 26% of the cases. So this agrees very closely with the study that I cited just a moment ago. But there was also a very important additional finding, and that was that in 54% of the cases, adult supervision was present. That means that an adult was standing there right at the moment of injury. And as an emergency medicine physician, now working for years in emergency departments, I can tell you what the parents say every time they come here. Doctor, I was standing right there. It happened so quickly, I didn't have time to react. And by the time I could react, it was too late. Now, what I want to assure you is that these are good parents. They weren't neglecting their children. They weren't mishandling the fireworks. They simply believed the myth that these products could be used safely. Important take-home message then for parents is that close parental supervision is not enough. The private use of fireworks is unsafe under any conditions. Now, there are many other reasons that we can talk about regarding why fireworks shouldn't be used. I won't have time to go into them today, but things such as hearing loss, the damage it does, and the trauma it does to pets, and these are all important considerations. But in summary, let me just conclude by saying that fireworks have been associated for years now with serious injury, especially in the pediatric age group. We know that these injuries can and do occur to children who are simply bystanders. And we know that supervision, close parental supervision, is not enough to protect your child from injury. So my advice is families should enjoy the birth of our nation, the 4th of July, by celebrating going to a public display run by professionals rather than purchasing and using backyard fireworks. Thank you.